Trying to conceive and feeling overwhelmed and confused with unhelpful information and advice? This podcast is for you. Welcome to Don't Tell Me to Relax. I'm your host, Hannah Pern, a fertility acupuncturist and passionate advocate for better fertility education and support. Our aim is to empower you with information to support your fertility journey and provide a community for connection with people who get where you're at. If you'd like to join us or work with us in clinic in London or across the UK, all the information is in the show notes at the end. Before we jump into today's episode, I'm quickly here to let you know that we are opening full-time for fertility acupuncture in central London, Victoria at the end of Feb. And if you're not in London, we have clinics around the UK and we work online. Hello and welcome to Don't Tell Me to Relax. I am joined by Marka today and we are going to be discussing the topic of egg quality, which is a topic we hear a lot about both within clinic and within our community, because we hear a lot of people talk about how they can improve their egg quality. If you open up Instagram and you search fertility, there are lots and lots of posts around ways to improve egg quality. Can you improve egg quality? Is it all about genetics? What do we mean when we talk about egg quality? It's a really complex topic and there are lots of different opinions about the extent to which you can make some improvements. The other thing that we hear a lot about is that women are told when their IVF is not successful, that the reason it's not successful is down to their egg quality. And I know personally, having worked with lots of people in clinic, that being told this is a very personal, difficult thing to hear, because you think that it is something that you have done, that you have some form of responsibility for this egg quality. And I asked Marka to come on and talk about this and unpick it a little bit, because it's not as simple as all of your eggs are bad, you can't conceive. There are a lot of processes and things that go into IVF and how eggs respond in clinic. So we are going to talk about that. So before we get into all of that, I'm just going to introduce Marka. So Marka is an embryologist at the Lister. She's a lead embryologist and she's been at the Lister Fertility Clinic in central London for about 8 years. This year, at the end of last year, we were lucky enough that Marka has qualified as an acupuncturist and now works in our clinic. So when she's not working at the Lister, putting sperm and egg together and creating embryos, she is working in our clinic being an acupuncturist. So as I like to refer to her, she is the unicorn in the world of fertility. She brings an amazing combination of skills and insight, both to us as a team and anybody that you work with or she works with in practice. So Marka, would you like to introduce yourself and tell us how do you get to be an embryologist and an acupuncturist?
Hello, Hannah. Thank you for having me here today. Yes, so I've been an embryologist for about now 15 years or so. By the time that I was working in Australia, I started to get introduced in the world of the Chinese medicine and the acupuncture, as many of the patients that I was seeing, they were having this kind of treatment to support their body in order to have like a better successful rates with the IVF. So I didn't know anything about the Chinese medicine. I didn't know anything about the acupuncture, and this got me interested into how the body works, or how another kind of learn more about like a different aspect of how the body works. So then I got into Chinese medicine. I got into acupuncture and I love it. And I can see like a very good results with patients.
And do you find it very different in that one is very scientific? I guess embryology is like so at the forefront of scientific, advancements, and Chinese medicine is kind of like steeped in kind of very traditional medicine. Do you find it difficult to switch from one modality to the other, or do you feel like the two are actually quite similar when you break it down?
I think by breaking it down, it is very similar. And just that by knowing kind of part of Western medicine and knowing Chinese medicine, there is a way to build bridges together. And that is the beauty of it.
So, Marka, egg quality. Can we start right at the beginning? What do we mean by egg quality and what does a healthy egg look like?
Right. So this is such an interesting topic, and I hope that I can give you like a clear answer to everyone to understand. So first of all, I have to say that the human egg, it is the largest cell in the body, and then it is very important. It has a very important role into determining the embryo quality and how actually are the IVF results. As well, something that we need to tell at first is like there is no test that it can check egg quality. We have a marker that it is the AMA, which give us an idea of the ovarian reserve, but not only tell us about egg quality. And I think you already have a podcast about AMH, right?
Yeah.
Cool. So after that, we have to say that we already born with all our primordial cells that they going to develop into an egg later. We born with all of them, and we don't produce more. So this is very important in order to understand how both nature and nurture it will influence in egg quality. So then what happened that as every cell in our body age along with us, so it means that all the cells, they experience changes and they are prone to suffer genetic changes, DNA damage, and everything. Then we know that the egg, same as the cells, the rest of the cells in our body, declines. The quality of those eggs declines as well with age. And there is a particularly notable fall from age of 35. So from about age of 35, the egg quality start to decrease, and this increases the risk of chromosomal abnormalities leading to high rate of miscarriages or failure of implantation, or even that embryo that it does not develop. There is no check that it can check the egg quality, but the way that we see the eggs or the embryos in the lab, it is all about morphology. It is how anatomically they look like, how pretty they are, how not as pretty they are. So in terms of how the egg look like, there are three main components. So we have what we call a zona pellucida, that it is a membrane or a coat that it protects the egg, the oocyte, and also plays an important role on the fertilization. And then we have the cytoplasm, that it is kind of a jelly substance that it is formed by nutrients and organelles, and this it will gonna nourish the embryo in the early development. And also then we have inside of the cytoplasm, we have the nucleus, and the nucleus actually contains the DNA, and the DNA is the one that it has all the genetics in it, right? So by checking the quality of the egg in the lab is only we can tell about like how all these components look like, but only about like the zona pellucida and the cytoplasm, because the DNA, we don't see anything. We cannot see it just hidden there. So the only thing that we can say is how it looks like, and we always aim for smooth and uniform cytoplasm with no fragments, no vacuoles, no small endoplasmatic reticulum, and also like a round or an unique polar body that it tells us that the egg it is mature. But unfortunately, we can tell like very little and nothing about the nuclei, the genetics of the egg, because we cannot see that. And then the only thing that we can tell when we doing an assessment is just how they look morphologically. We will know more about the egg quality when actually the embryo develops, and at the early stages of the embryo development, how this it gets nourished by the cytoplasm. But again, if the genetics it is not right in the egg, nothing we can do, basically. Yeah.
Yeah. And I have the impression that because you can't test for egg quality, because there is no test, unlike, I guess, we can do tests for semen analysis, we can do DNA fragmentation on semen. So you can see what impacts it, you can see what can make changes to it. Whereas for egg quality, because we can't really measure it, it's much more difficult to then go, for example, you know, studies have shown that giving up smoking improves sperm parameters. And there are studies because they've taken sperm before and after, and you can see the improvement in the parameters. Whereas with egg quality, it's not as simple to measure. I mean, we assume that it does because obviously, you know, cigarettes harm every single cell in the body. And like you said, it's a cell in the body. So you assume, but it's difficult to be definitive about that as there is no test for it.
Yeah, it is. And basically because they are so precious cells in the body that we born with millions of eggs, but it actually at the time that we get to adolescence or like we ovulating like one month by month, it is only one. It is not like a sperm that every time that we have a sperm sample, then there are like millions of sperm. So you can make an assessment of this sperm sample by telling on average, like how it looks like, how good or not as good it is. But in terms of eggs, every single one is treasure. So it cannot get tested. It can, because by testing the genetics, testing the egg, you have to destroy the egg to actually get into the DNA. So then it is not a technique that it is suitable. We have to see how actually it's fertilized, it develops, and then the only way that we can test it is just by doing genetic testing on the embryos that they are already grown.
And can I just ask you, because you mentioned the age there where there is a decline in fertility. So you mentioned 35, and I know a lot of people will be listening to this, and you know, people hear the numbers around age, obviously, and it causes a lot of stress because, you know, lots of people don't start having their families now till later in life. Lots of women either don't meet somebody, not financially ready or not emotionally ready. All of those circumstances aren't there. So tell me, in your experience of seeing eggs in a lab, is it very individual? When you say 35, are we talking like statistically, you know, like across the board? And does that vary a lot within the lab? So how much is age a factor on an individual level? Like, I don't know what my question is, but yeah. Can you say a little bit more about the age thing?
Definitely, it is a factor. So definitely it is a factor. And definitely at some point, you have to put a cutoff on age, right? And it is true that by over like 30s, 35, the egg quality declines. But of course, this is on average, and then not every single woman, I will say that it goes through these parameters, but it is always we are talking with everything on average. It is true that eggs that are younger, they have more chances to be genetically normal than the eggs that are older.
Yeah, and I often have the conversation, and I'm sure you do too, in clinic around the idea that, you absolutely can conceive over the age of 35, 37, 40, 41. The issue is it's about finding those genetically normal eggs becomes more difficult because the body produces less of them. And there is a part of that is hugely genetical, of which we have no control over.
Exactly. So as we age, the supply of eggs it is less, and also the genetics of the eggs they're getting more damage as we do our old cells in the body. So it is more difficult just because of that, because the ovarian reserve it is less, and as well they are genetically more damaged.
So when we talk about being able to improve egg quality, what are we saying? What are we talking about when we talk about egg quality diets, egg quality lifestyles, egg quality, this, that, and the other? Lots of people say acupuncture is linked to improvements in egg quality. What do we mean when we say these things?
Right. So this is really important and as well a very interesting question. So the egg quality, of course, it is influenced by the genetics, by the nuclear and the mitochondrial genome, but also it is influenced by the microenvironment that it is provided by the ovary. So the follicles where the eggs they are contained and they are growing. So what we know is like the eggs that you are ovulating this month, basically. So it has been growing, recruited, and nourished like a year ago. So from a year ago, these eggs it is on its way to get developed and growing, and then at some point after more or less about 1 year, then it will ovulate. You are ovulated. So then we know that there is a 3-month window time before this ovulation, that those eggs, the follicles that those eggs are contained in, they are supported, or they are these follicles they receive nutrients, and they rely on nutrient and hormones that come through blood vessels. So then when we're talking about like improving quality or how we can influence quality, it's like by supporting the blood flow, by supporting the nutrients, the hormones, the oxygen to get into the organs, to get into the follicles, to give the better chance for those good eggs, the genetically good eggs, to give them the better chance to develop well and have the better chance to ovulate it, then it can be like fertilized and get into a good embryo. So that is how can we support the equality in that way, only in that way. Nothing we can do about genetics.
Yeah. So can we say that it helps improve the health of the ovary, so therefore the number of follicles that the ovary produces?
Just to give the better chance to the ovary or to the follicles to grow to the right stage.
Yeah. Okay. Yeah. We're supporting with the nutrients and the blood flow, good amounts of oxygen, and the follicles to grow well enough to ovulate and mature an egg, and that egg to be the best quality it possibly can, to give those genetics, if the genetically normal DNA within that egg, we're creating more opportunities for there to be genetically normal, healthy eggs to be fertilized either in a lab or in a natural cycle.
Yeah, for that one, that it is already genetically normal, because for the ones that are genetically abnormal, unfortunately, nothing we can do.
Okay, so I guess that's a really important part, isn't it, for people to know that there is a degree to which you can influence it, but there is a degree to which you can't, and it's about being really clear on what is possible and what isn't possible. And when we're talking about ways to improve egg quality, we're not talking about genetics, we're talking about the external factors within which that egg is matured and grown in the follicle and the health of the ovary to produce the follicle.
Yeah, exactly.
So tell us, in your opinion, like, what are the best ways to do that? Because that is a multi-million-dollar question, isn't it? Like, what are we talking about?
Yes. So what we can do is, I think we can do a lot, but not only to improve our reproductive health. It is all starting with overall health and overall well-being. And then all this, it will impact every single aspect of our body. And so with genetics, we say that unfortunately we cannot do anything. But then there are a lot of aspects on our lifestyle that we may can improve. And this is about our diet, healthy and balanced diet, antioxidant diet, fruit, veggies, grains, some red meat, variety of food, avoid all the packaging and all the packaging food, and avoiding all the fast food and processed food, all this. Then also exercise. By exercising, we can help to reduce oxidative stress that it can impact on all our cells in the body and the eggs as well, by supporting the blood circulation. But by the exercise, we support the blood circulation, and also helping to decrease stress. And another way it is managing the stress, because we know that high stress increases cortisol, right? And then all these cortisol levels, it will affect the hormone production from the hypothalamus, the pituitary glands, and also decrease the blood circulation in the ovaries, basically. Avoiding alcohol, smoking, all those factors affect our body hugely. And also what we can do is like sleep, good sleep, solid, regular sleep, promote good hormones and regulate insulin. And it is one of the big points of health. It is sleeping, diet, exercise. Great. What else we can do? What you do, Hannah, what I do, acupuncture. So we can help with the acupuncture as well. Most because with acupuncture, we can basically support the body, and also calms anxiety, calming the nervous system. How important it is for patients that they are trying to conceive, that they are doing IVF. They also would like to freeze eggs, because it is not the right time now for them to get pregnant, but they want to have choices. This is like a really important as well. So we can tailor acupuncture treatment to all the individual needs.
Can I just ask one question, Marka, before we go, around egg quality and this idea around IVF and IVF treatment protocols? So when somebody's doing IVF, you're obviously using drugs to stimulate the ovaries and grow the follicles. And that this idea that, I guess, until you've been down the road of IVF, it's very easy to assume that all IVF is the same, that IVF is IVF, because that's what you hear. But can you just tell us a little bit about the IVF drug protocols have different effects on people and different impacts on egg quality or number of eggs, and it does vary from cycle to cycle and person to person. Can you say something about that? Because I think it's something that we don't hear so much about, but it's important to know.
Oh, what I will start saying that actually we are all different, and we have our own genetics, and we are all living in different kind of environments, and we have different routines, and we eat differently and everything. So not all the drugs and all the protocols that they are up there for the IVF, they will fit for everyone. I would say so. Yeah. And then the expectations of patients when I think they come into the IVF. And then I'm seeing this like more here now by seeing patients in this treatment, in the acupuncture treatment room, that patients, when they want to, they go to the IVF clinic, and then they think that the IVF is going to be the solution. And actually they find out that it is much more difficult than what they were expecting, because maybe this drug protocol is not agree with them. Then they need to change to another protocol.
Yeah.
I don't think that like every protocol, and we know that not every good protocol makes the patient respond the same. Otherwise, it will be just one protocol and that's it. So that's why the different options for the different people, and as well different conditions, because as well is not only just how you are. It's like they are comorbidities and they are other diseases, or like a patient that they need extra support. So it is a whole world.
And I think that's the important point to get across, isn't it? Because sometimes I know we've had questions in the community that people have done a cycle of IVF. It hasn't been successful, and they've been told the IVF isn't for you, it doesn't work. And I'm not saying that, to go for round and round and round off IVF, but sometimes it might be that particular protocol, that combination of drugs, the way you were stimulated was not the right or the best one for you at that point in time. And so sometimes changing clinic, changing the protocol, mixing things up can make a huge difference to the outcomes of the eggs collected.
Yes, I would say so. And I'm agreeing with you. But at the same time, I have to say that the best to know that if that is the case is that you are coming into the IVF cycle with the best of you. With the best of you is like that you know that you are in your best shape.
Yeah.
Saying, that you have prepared your body for the best before going into this kind of treatment, that they're gonna be like really how I'm saying, like hard on you, because not only hormones that you get into your body is psychological, it is physical. So it is hard to get all these things, and then if your body it is not in the best shape because of your diet, because you are not exercising, because you are smoking a lot, because you are drinking a lot, because like many factors, or pollution, or like many other external factors. I think as well we have to be responsible as a patient to give the best of you first, and then knowing that if something is not working, then you can find other options or you can look for other options.
Okay, Marka, that is amazing. Thank you so much for your time today. It is so insightful to listen to you. And I just want to say well done, Marka, because this is your first podcast, and doing a podcast in a second language is unbelievably amazing. So thank you for being brave and taking the time to do this for us today. Really, really appreciate it. And I know people listening will really appreciate your insight, your unique insights that you've been able to share today. So thank you very much for your time.
Thank you, Hannah.
We hope you have found this helpful. If you'd like more on fertility education, please see our Teaching to Conceive free course linked at the end of the show. You'll also find the link to join our community. For more personalised fertility support, you can work with us one-to-one in clinic and online. You can book a discovery call to find out more.